Good. Lift up your tongue. Great.
Smile, Greg. You're supposed to be having a good time.
Just to be enjoying
I'm
this.
still
right?
on camera.
You're still on? She's still on camera? She
Yeah.
loves you.
I know.
No, I love YouTube.
She's wide awake now. She was real sleepy a while.
No, I'm not wide awake. I'm so flaky.
Give her that
Just-
camera, man. She'll. Okay. The tent peg down the middle of your nose is your
Yes.
septum. There looks like there's some scab tissue on your septum on your left side. There's no active bleeding in that area.
Okay.
I think what we would like to do would be to try to see if we can, number one, get the blood pressure under control.
Okay.
There's some things we can do. Right now, I could cauterize that area. And by that I mean, taking a little silver nitrate up in that area and chemically cauterizing it to
Okay.
stop any bleeding. But that hurts, and I'm not sure if you need that or not.
Okay.
The second thing that we could do is that we could treat you conservatively, and that's by using salt water sprays in your nose
Okay.
and emollients at nighttime. Emollient is something like Vaseline or something in that area.
Okay.
We have both at home.
What has he been using at nighttime? The other thing is, do you have a vaporizer or humidifier at home too?
No, I can get one.
Okay. Can you see Dr. Carlson have you seen him about high blood pressure at all or not?
Every time I've seen Dr. Carlson, my blood pressure's been normal.
Okay. Were you in a lot of pain when you had the bleeds?
I
Or was
was
it just really nervous?
really frustrated. I've always been able to get him to stop in 5 minutes.
Oh, he was hungry.
And I was hungry.
Okay.
And I just ran
And
up
I
the
had
stairs.
cooked.
How do you stop your nosebleed?
Either pressure or a small piece of Kleenex under the lip.
Okay.
between the lip and
The
teeth.
best way to stop your nosebleeds, I know where that area is. It's on your septum, right up front.
Yeah.
Grab your nose like a clothespin
Mm-hmm.
and to hold it together with both fingers and to hold it for about 5 minutes and then
Yeah.
let go. I mean, are you on any aspirin or any Motrin?
I take aspirin for arthritis and headaches.
How often are you on aspirin?
I took 3 last week, 2 on Monday and 1 on Tuesday.
Okay.
And it's,
Aspirin, as you know, thins your
Yeah.
blood and it's going to make your nose bleed more. My feeling would be if it's possible to use other things like Tylenol for your arthritis. It probably doesn't help that much.
no.
But if we can avoid the aspirin, that would help from the nosebleed point of view too. I'd probably like to, could I have you see Dr. Carlson just to make sure about the blood pressure?
Sure.
And she'll probably give you something to do serial blood pressures with. So you get even, to come in periodically just to check off in the morning, get some blood pressures over a period of several days.
Okay.
Because that's really high. I mean, that's scary high.
Yeah.
And you have no history of heart disease. You told me you're adopted.
Yeah.
Okay, no real history of heart disease. No recent nasal trauma.
No.
I haven't hit him in years.
No, she hasn't.
I think he needs a good hit every now and then.
Yeah.
Oh, God, no.
What I'll do, what I'd like to do is I'll let Dr. Carlson know that I saw you here today. I'll dictate up a letter to her and send that to her. What we'll do is to see you back again, if I could, maybe in about 3 to 4 weeks. I want to make sure this is healed all on the side of the nose. If you're having more bloody nose difficulties, what I'll do is cauterize that area. But several things again. Number 1, no nose picking. That's always number 1. Number 2 is lay off the aspirin. No aspirin. Number 3 is to use the Vaseline in your nose at nighttime, and you know how to pinch your nose.
Oh, yeah.
The last thing is to use the saltwater sprays.
Yeah, I learned how to take care of my nosebleeds before I could read. And I mean that literally. I had them when I was 3 and 4 years old.
Yeah, but you're 55 and things have changed.
I've had practice.
Well, see, now if we forget the doctor's directions,
Yeah, we've
They're
done
right here, man.
they're right here.
They also have some hearing loss too.
a little.
Tell me a little bit
A
about that.
little?
Talk to Mama about that.
You can talk to her, but I
What?
had some hearing loss in my left ear. Found that I augment my hearing with a little bit of lip reading
When was the last time you had a hearing test?
about 5 years ago.
Okay, what we may do is when I see you back here next time, I want to make sure this nose is taken care of. We'll probably get an audiogram with it too. We'll set you up here. All
Can you
right,
read my lips?
Twice.
what'd she say? What'd you say?
Something not nice.
Okay, don't record that on there now. All right, let me see you back 3 to
Okay.
4 weeks. I'm not going to give you any medicines,
That's
other
fine.
than to say keep Vaseline in that area. But Vaseline is right in the front of your nose. Come up, take a quick look over here. We took that scope, went into your nose, all the way to the back of your nose, all the way down to your vocal cords. The problem is right up in the front of the nose. So if you take on your finger a little bit of Vaseline or triple antibiotic ointment and rub it on the inside of your
Okay.
nose, on the inside where the tent peg is, that'll keep that area moist,
Tent peg.
especially at night.
Yeah.
The tent peg holds up the nose. It's that little stake. It holds up right down the middle is where the septum is, and that's where the bleeding is, right on this area. So he put his finger in his nose and put that goop right over here on the left side.
Okay.
Okay.
No nose picking.
Now with that
I
camera,
He
don't have a
doesn't.
truck key anymore.
that camera, there's no excuse for you not to get everything right on there. Now listen to this over and over again. And I'll see you guys in 3 to 4 weeks.
Okay, take
get some
care.
sleep.
Yeah, I need
Bye,
it.
guys.
Bye, thank you.
You guys won't have it.